In 2016, it is estimated that almost 50,000 people will die from colorectal cancer, making it the second deadliest form of cancer in the United States behind just lung cancer. The treatment that patients with colorectal cancer receives depends on what stage of cancer they have. In stages 1, 2, and 3, the treatment involves surgery known as a resection. During a resection, the section of colon or rectum where the cancer is located is removed, and the two remaining ends are reattached. The problem is, despite having all of the cancer removed, some undetected cancer might remain or develop over time, and then reattach to the wall of the colon, causing a recurrence of colorectal cancer. And when the cancer comes back, likely at a later stage, this can require further resection as well as chemotherapy, which is recommended for stages 3 and 4 cancer. The top 3 most commonly used chemotherapy regimens are seen here, and while the costs of chemo can range greatly, they can cost up to over $38,000 for 6 cycles of therapy. So following the original resection surgery, what if there was an effective way to decrease recurrences and subsequently decrease the mortality and enormous costs that come along with treating the progression of this deadly cancer? Better yet, what if this could be achieved by using cheap over-the-counter drugs that have very benign side effect profiles? While this might sound like a long shot, a 2012 Cochrane review by David and Jamieson found some promising results looking at histamine type 2 receptor antagonists, or H2RAs. This group of drugs includes ranitidine, cimetidine, famotidine, and nizatidine, but these drugs are normally used for treatment of gastroesophageal reflux disease, or GERD. So how is it that H2RAs can have a beneficial effect on preventing recurrences of tumors? Well, as it turns out, histamine plays a very important role in tumor growth and proliferation. Epithelial tumor cells secrete high amounts of histamine into the microenvironment surrounding them, which prevents tumor-infiltrating lymphocytes of the immune system from realizing that the tumor is foreign. In other words, histamine hides the tumor from the immune system and prevents it from attacking it. Additionally, histamine has been shown to have a direct proliferative effect for colorectal tumors, which helps these tumors grow. Cimetidine has a unique third mechanism in which it inhibits E-selectin, a ligand involved in tumor cell adhesion. Because histamine is such a major player in tumor recurrence, it makes sense that histamine antagonists such as H2RAs would have a beneficial effect in preventing these recurrences. The Cochrane review by David and Jamieson, which analyzed 6 randomized control studies of H2RAs, showed a strong trend toward survival due to decreased tumor recurrence. The overall hazard ratio was 0.70, although this result barely missed the mark of being statistically significant with a p-value of 0.07. This is not surprising, however, considering the small sample sizes of the trial and the lack of power needed to detect a clinically meaningful improvement, which is stated by the authors in the review itself. Because of this, the use of H2RAs for this purpose has not been adopted in practice. Furthermore, because these drugs are all generic and available over the counter, there is little incentive for the pharmaceutical industry, the major funder of drug studies, to fund further research looking into the matter. No major studies have been conducted since the Cochrane review in 2012. So how feasible would a study on these generic drugs actually be? Well, considering the potential huge cost savings that could result from preventing recurrences of colorectal cancer by using these cheap generic drugs, our proposed study appeals particularly to accountable care organizations. ACOs are founded on the principle of driving down healthcare costs by reducing unnecessary spending and are incentivized by being paid a fraction of any savings they generate. Given the recent surge of ACOs following the passing of the Affordable Care Act, we feel that only now is a study like ours feasible. We propose a retrospective observational analysis on the use of H2RAs as adjuvant therapy following colorectal resection. Our study would look back at VA data, which is the perfect source for a retrospective observational study, since these data sets include patient diagnoses, medication lists, and cost data. Because the use of H2RAs as adjuvant therapy is not common, our study would observe the effects of these medications by identifying patients undergoing resection who also have a diagnosis of GERD and are on these medications for this purpose. To prevent any effect that GERD and its treatment would have on our outcomes, our proposed control group would consist of patients undergoing colorectal resection that also have GERD but are on proton pump inhibitors instead. Clinical gray area and maintenance GERD management when it comes to PPIs or H2RA prescribing provides a unique opportunity to use an instrumental variable study design, which effectively randomizes all other baseline traits, including unobservable traits between our treatment and control groups. After establishing our instrumental variable of variation in provider prescribing patterns between different VA sites in regards to H2RA or PPI use, our study will compare survival time between these two treatment groups over 5 years by analyzing data from the National Death Index, which is the most accurate and comprehensive mortality aggregate available for patients in our study. Lastly, our study will examine both inpatient and outpatient VA cost data, which will capture costs of medications, screenings, surgery, and radiation procedures for 5 years following resection. This will allow us to measure the reduction in cancer-related economic burden between our treatment group and control group. If the study results are significant, routine use of H2RAs could become a refreshingly cheap and effective treatment option after years of rising costs when it comes to the treatment of colorectal cancer.